Hello, 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 hello. Everyone's here. Hi. Hi, Henrietta. Hi, Auntie Dolphine, Chezo, Nonjang, Mark Floss of Fingers. Wow, you guys are amazing. Thank you very much. Good evening, good evening, good evening. Welcome again to another episode of The Woman Experience with me, your host, Goretti. So for those of you who are joining us for the first time, you're very welcome to the Woman Experience. We call ourselves the Woman Experience Tribe. We are a community that is growing in numbers and in benefits. I would use that term. So I thank you guys for spending your Friday evening with us today. We are on episode 50. We've done 50 fantastic episodes. And what that means is we've talked about everything. We've talked from widowhood to mental health. In between, we've talked about infidelity. We've talked about name it, we've covered it. And so if you're here for the first time, please don't leave without checking out the rest of the 49 episodes. Yeah, there's something there for everybody, trust me. So tell a friend to tell a friend that we exist. The Woman Experience platform exists for you, and it is not a show just for women. It is a show for us all Cameroonians. Obviously, I'm biased, I'm a woman, so we call it the Woman Experience, but you know what I mean. So thank you. And stay, don't go. Like I said, there's 49 other amazing conversations that we've had that you're sure to find your pick. So go back after this, go back, spend some time on our page, the Woman Experience page on Facebook, the Goretti Experience page on Facebook, and the Goretti Experience page on YouTube. Spend some time there and watch some of our shows. So thank you so much for being here. Yeah, welcome. Like our page, don't leave without liking and subscribing. And if you're new, again, like I said, we had a series on mental health, which we were doing to commemorate Mental Health Day, which was last Saturday, October 10th. We did a short film on mental health, and we spoke from the man's point of view. It's available on our page, this current page, the Goretti Experience, both YouTube and Facebook. So if you haven't already, take some time and watch that and learn. And yeah, hope you like it. And if you do like it, why not share if you know someone's going to benefit from it? So we're in October. And if you don't know, October is Breast Cancer Awareness Month. And I'm so privileged. And the color for breast cancer awareness is pink. So this is the closest thing I had to pink that I wore for you today. And what we're doing tonight is talking about breast cancer and prostate cancer and cancers in general. And I'm so privileged. So privileged to be able to have Dr. Joyce Akwe, and who is a doctor of medicine in the USA. She's joining us all the way from the USA. And we also have a mother who is a 2 times cancer warrior. So she survived cancer 2 times, and I'm so proud. And you wouldn't even, I mean, you need to meet these 2 women, very dynamic and wonderful personalities. So we're going to be talking cancer tonight. If you haven't already, please take a minute and share. And while you're sharing, thank you guys for joining. Thank you, Bill Foster, joining all the way from Cameroon. Yay. Thank you so much. Without further ado, I'm just going to bring my wonderful, beautiful guests to the show. I'll start with Dr. Joyce Akwe, and I'll bring Elmina.
Hello.
Hi, ladies.
Hello.
Elmina. Okay. Can you hear us? Elmina, can you hear us? Elmina can't hear us for some reason. What just happened? We've been talking backstage. Elmina, do you want to lock? Can you hear me? You can't hear me. Okay. Log out. I'm going to kick her out. So what I'll do is kick her out, and then hopefully she'll join us. So while she while she joins us, Doc, hi, you want to say welcome to our guest on behalf of us all, or you and Elmina?
Well, yes, and thank you for taking your time to watch us today. And I think we have an interesting program, at least an informative program for those of you who are listening today. I hope you can take home something really tangible that can make a difference in your life, or at least to the life of your loved ones. So, as you already heard from the host, we will be talking about breast cancer today. And we have Elmina now, and I think we're going to start with her.
Yes. Elmina,
Yeah.
finally. We've been starting with you. So welcome back to the show, to the Woman Experience, Elmina. And so many people are in the comments saying hello to you guys. So Elmina, you are a warrior. You survived this 2 times. I mean, I just want you to tell us this second, this second time, the breast cancer. How did you come about? How did you find out that you have breast cancer? What?
I was sweating a lot, especially in the armpits. Like I used to change between 7 in the morning and 3 in the afternoon. I used to change my top 3 times or 4. So I used to sweat a lot, and one of my friends joked like, "Oh, you're turning like, menopause." We laughed about it, and one night I was hot, and I did that, wiping off the sweat from my neck.
Yeah.
And I did that, and I could feel the lump. And I'm fortunate to have small boobs, so I could actually feel the lump. So as soon as I woke up in the morning, I called my GP.
Yeah.
And because of my previous case, I'm on high alert. So as soon as they heard from me, they asked me to come in straight away.
And the procedure started.
Yes.
Okay.
Yeah. So my doctor was so good. The GP was really good, because while I was sat there, he did the test. He goes, "I'm gonna send you for a mammogram."
Yeah.
And within 10 minutes of him checking on me, he booked the mammogram already. And he was like, "You have to go in." So it took a week for me to get in to do it. Yeah. So
wow. I mean, I every time I listen to this, I still go, wow, just because you're so lucky. So before we even go right into the depth of your story, Elmina, by the way, is a mother of one and married, happily married, and a mother of a 6-year-old YouTuber.
Yeah, YouTuber.
So, yes, I'm gonna Doc. So Elmina has told us a bit of her story, but before we even get right into the depth of it, let's start back, take a few steps back, and start from the basics. Doc, we have heard about cancer as cancer, like cancer. What exactly, doctor, is cancer?
Okay. So again, cancer just refers to an abnormal, unregulated growth of cells, which can be from any organ of the body. And if it's from the breast, we call that breast cancer. If it's from the stomach, it is stomach cancer. If it is from the liver, it is liver cancer. It usually starts from one organ, but it can spread to other organs. And that is metastasis of the cancer. So when you hear of cancer of any organ, you know that is where the cancer started. But then it can spread to other organs. And breast cancer is the same. It's cancer of these breast cells that end up growing rapidly and spread to other organs. And the reason it grows rapidly is because it is unregulated. One of the reasons why cells don't just grow abnormally is because our system does have regulatory systems in place, which if any cell grows to where it needs to be, it no longer can grow. And then we actually have systems to kill those cells once they get to a certain age or they have some abnormalities. But cancer cells have been able to elude that system and grow continuously and cause a lot of damage. And of note is the fact that cancer cells again, use a lot of energy. They have to feed themselves in order to be able to grow the way they do. And that explains why a lot of cancer patients are usually very tired, very weak, lose weight, because the cancer cell is actually taking everything that you need for the rest of the system to survive.
Thank you for that very detailed explanation, Doc. I'll go back to Elmina. By the way, I love your pink. It's just beautiful, and your hair, like everything about you, is popping.
Thank you.
And I think that you're, for anybody who is probably going through something like cancer right now, I think you are the what should I call it, the billboard for hope beyond cancer, because you look a picture of good health.
Thank you.
So even if you're going through your really darkest moments out, I ask you tonight to anchor onto Elmina and know that there will be light at the tunnel, at the end of the tunnel. Yeah. So Elmina, listening to Doctor speaking about defining cancer and describing cancer cells, for you who has been through this twice, what's your journey with cancer? Like, because what was the first time? What kind of cancer did you have, and what do you think caused this, or what did they tell you caused this now breast cancer?
The first one was a soft tissue sarcoma on my upper left thigh, and I think it's the same thing that caused the second one now. I was born with a pre-existing condition called neurofibromatosis type 1. And it leaves you with loads of fibromas, if you can see. And at any point, any of them can turn into cancer. So I am on high alert with my doctors. I do checkups very often. So when I called in and said there's a lump in the breast, because I've had 3 lumps from here taken out and 2 from here, which were benign. So this time around, when I went in, when I felt the lump and I called them and they said you had to do a mammogram. And I remember the doctor that did the mammogram was like, oh, it might just be a lump. If it's just a lump, we're not going to do anything. And because I was laying down, as soon as she said that and I stood up, I'm like, no, not me. She goes, oh, no, it might be nothing. I'm like, I'm sorry, you don't know my history.
Yeah.
It has to come out no matter what it is.
And I think that I would interrupt there to ask Dr. Akwe a question, because Dr. Akwe, you are very big on us advocating for ourselves. You always say that.
That is correct. And just as Elmina did, if you go to the hospital and you feel like something is not right, or you go to your physician and you felt you're being dismissed, you should speak up. You should speak up for yourself. You should speak up for your loved ones. If something is awfully wrong and you know that, don't take no for an answer. Make sure that you have satisfactory explanations before you go. One of the things I do actually advocate very strongly for is that before you go to the hospital, Google, search for information. Go there with questions for your physicians and ask them questions. They do have explanations for this, but if you go there and you give the impression that you're ignorant, that even if they explain, you will not understand, they will not explain. So go there with information, be informed as much as you can yourself, so that you can ask questions that make sense. If you even Google and say, what questions should I ask my doctor with regards to something specific, they will tell you. It will give you some ideas. You can start from there. And once you give, I think for me as a physician, and I think it's the same for several other doctors, we like to see patients who are engaged in their health, who will ask you questions, who want to know what is going on. And because you know for sure that if you're giving them medications and you explain why they should get those medications, they will take those medications. It's concerning when you go to, when I have a patient and everything's okay, all right, yes, okay, any questions? No.
But you see, and I think this is, and I'm glad that you're saying all of this, because in our culture, I know that, especially coming from Cameroon, everything that the doctor says to us is gospel truth. we accept it as gospel truth. We really don't question the doctor. Have you ever had a family member sick in Cameroon and say, and you ask, but what's wrong with him? And no, doctor, no talk, nothing. That's all you get. You understand? So if you're speaking, and we know a lot of people that are watching from Cameroon, and hopefully some physicians are watching this show as well from Cameroon, what would you say to the person who is the patient, and what would you say to the physician, doctor?
So, I mean, if for you as a doctor in Cameroon, people are more knowledgeable than they come across. Be patient with them. Talk to them. Ask them if they've understood what you asked. If they don't understand, or if they tell you they've understood, ask them to repeat what you said in their own words. What did they understand? So that you make sure that they're leaving your office, they're leaving the hospital with a clear understanding of what is going on with them, with a clear understanding of their health condition. And most importantly, with a very clear understanding of what they have to do once they get home. And so for the physicians, we have to just make sure that the patient understands. For the patient, you have to do your homework. You know, it's your health. You have to take ownership of it. You have one health, you have one body. You don't have any opportunity to try it to see what works. That is it. If it goes, it's gone. So
yeah, so that's why the doctor is saying that we should make sure, even if you're in Cameroon, just do your research. Just find out about this thing. Everybody has a bit of internet now, so a quick Google search will answer that. So this thing on Elmina, do you mind showing your chest again? See me pulling my chest out. Okay, see, I know quite a few people who have that, and if somebody is working with auntie, mother, or somebody who has NF1, right? Elmina,
yes, NF1, yeah.
If somebody whose family, sister, or other has NF1 on their body, how does NF1 present itself? Does it always present itself on the chest, or could it be anywhere else, or how does it look like?
It's everywhere on the body. They count it by look at cafe au lait spots. It's like freckles or really dark birthmark. Really dark birthmarks. If you have more than 5 as a child, that's one of the signs, and it has to be what you have to have your armpit, in the groin, and I think on your back as well. Those are where it's supposed to be for it to be considered NF1.
Okay, so your back, your groin, your armpits.
Yeah, your armpit just there. Yeah, and the groin. Yeah.
So, Doc, if I'm a concerned parent now, and I see that maybe my auntie has this thing, or my brother, or my loved one, or my child presents with stuff like that, what can I do? First of all, is there any prevention I can do to be able to stop it? I don't know, becoming cancerous, or what can I do with that information?
So let's just step back a little bit. NF1 is neurofibromatosis, and I will not repeat the name again frequently. It may just come out. But again, neurofibromatosis is something which is usually associated somehow to mutation of your genes. And so it can be inherited, but it can be sporadic. Up to 50% of people who have NF1, they're the only ones in their families who have it. Right. But then, if you have family members who have NF1, the way we do diagnosis, this is one of the few things which has very clear-cut criteria for diagnosis, that you do not always maybe need genetic studies to do it. They have symptoms, just as Ermina had already described. So if you have more than one, if you have 2 symptoms, 2 of those involvements, then it is considered a diagnosis, definitely. So if that is a concern, you can see a medical professional, and one of the things we should do is either send you for genetic counseling, and once you go for genetic counseling, you go with family members. I'm not exactly sure if Ermina had that experience that she had to go for genetic counseling with family members, but there are people who that is what they do, that is their expertise, and so they do genetic counseling and kind of like give you guidance as to what to do next.
So, but if I don't have access to genetic counseling, I'm thinking of the Cameroonian back home, or the African in some remote village.
Right.
is there anything they can do to prevent that becoming a cancer, or there's no cure for it, or it's just to pray to God and hope that a miracle happens?
So not every cancer is preventable. Some of the cancers we can't really do much. Something like NF1, if it's going to develop into any form of cancer, it is preventable. One of the most important things I want to bring up about NF1 is the fact that breast cancer is not even one of the cancers that is very much noted to come with NF1. NF1, yes, it's not really one of those. But the main ones for NF1s are usually like brain cancer, cancer of the eyes, cancer of the adrenal glands, cancer of the spine. But breast cancer is not a common one with those. And this kind of like also gives us something to really think of. Once you have one cancer, it doesn't exclude you from having another type of cancer.
Really?
Yes, it's not an exclusion. They're not exclusive. It's very possible that Ermina's breast cancer has nothing to do with her neurofibromatosis. Because if you look at the main cancers that come with neurofibromatosis, breast cancer is not one of them. Now, the mutations that occur in the gene area that form neurofibromatosis can have very many types of mutations. There are a lot of them. And it just so happens that that particular gene area is an area which is very large. Very large means it also presents large possibilities for mutation. So it depends on the type of mutation that you have in that area. The presentations are different. Studies have shown that over 70% of the people that have been studied for neurofibromatosis had different types of mutations. So it's not like the same thing, and so expecting the same type of results.
So Henrietta is asking that, is it similar to the black spots that some women have around their neck?
So again, it's interesting. It's very important for us to see the black spots. But one of the things which I would just kind of like put out there, which can be common in black people, is maybe a very dark area, really black area around your neck. That black area is common in people who have like obesity, people who have diabetes, and it does have they call that acanthosis nigricans. That is a completely different thing. But if you see like these black spots, the neurofibromas are not just the spots; it's actually a growth.
Yes,
it's not. Yes, it's a growth. It's not flat.
Yeah.
And then you have what they call the cafe au lait spots. Those are spots which are really cafe au lait, as most Cameroonians know, is coffee on milk, right?
Yeah.
So they are just like white spots on the dark skin area, or vice versa. So you have those spots which are like that, and it looks like it's coffee and milk, and because of the way they look like. And those are spots which are very much indicative of maybe neurofibromatosis, but you do have to associate them with other things for you to say more securely or more confidently that this is neurofibromatosis or NF1.
So it's not freckles, is it?
What did you say?
Brigitte is asking, is it freckles? So is it freckles?
No, it's not freckles. No, it's completely, it's not freckles.
Okay. Oh, that's a relief. If you can do that. So Elmina, so for you, so you had NF1. Doctor, I think I want to go back to you. Elmina's NF1 led to breast cancer. What are some other risk factors for breast cancer?
So yes, standard risk factors for breast cancer is, the first thing is your age. The older women become, the more they can have breast cancer. Once you start hitting 50 years and above, breast cancer start really increasing. And hitting 65 years just increase your risk of breast cancer exponentially. The second thing is your race. People who are from African origin, or in other words, Black people, have a very high risk of having breast cancer as compared to people who are from Caucasian or Western origins. One of the things which is very...
Let me ask you, why is that? Because we know that cancer now, why man sick?
Well, that's what we know, probably because we didn't know more, you know. But yes, unfortunately, there are certain things like that which are more prevalent or in Black people as compared to white people. You have other things like having a dense breast. I'm sure a lot of women have heard of dense breast, and that is something which usually is scary. And I can go over what a dense breast is. So if you look at the two pictures you have on your brain on your screen right now, the picture on the left, the one which is less wide, is a picture that is not, it will not be considered a dense breast, and the one on your right is a picture that is a dense breast. And what is a dense breast? So do you have the picture of the breast? Let's just go. Okay, good. So if you look at this picture of the breast is made up of fundamentally of, let's say, three major parts. You have fat tissue, which is most of the breast. As you can see, the area in yellow is just fatty tissue. Then you have the area which is in purple, that is the lobular area, and that is where, those are the lobes where you produce milk. And those are areas which, once milk is produced in those areas, then the milk is then transported to the nipple using the ducts, as you can see on the image. Those lines which come from the ducts, from the lobules to the nipple, those are the ducts. So when someone has cancer of the breast, it can be from any of those areas. It can come from the ducts, it can come from the lobules, and the lobules are held in place by fibrous tissue. Can you put the other side image of the breast? Good. They're held together by fibrous tissue. It's in between those lobules, as you can see. This is a lateral image of the breast. So what happens is, if they take a picture of if someone has more fibrous tissue and more lobular areas as compared to the fat area, that is considered a dense breast. If someone has more fatty area than the lobular and fibrous areas, that is considered a non-dense breast. It's not really like a normal breast. So any person who has a dense breast has a higher tendency of having breast cancer. And we can go a little bit into details as to why. So people who are, again, Black women have a higher tendency of having dense breast, and so a higher tendency of having breast cancer. But again, there's one little sweet thing in between. Even if you have the breast cancer because you are someone who comes in originally with dense breast, your cancer is not more aggressive than someone who does not have the dense breast but has cancer. And I will just go over the other risk factors, and I want to come back to this dense breast because that is some of the things that we get a lot reported in our mammograms, and we don't know how to handle them. And the first thing you go in online, it just tells you dense breast means, oh no, this person does have it. It means I have a higher risk of cancer. And once people get that, everybody freaks out. People become anxious. It's nerve-wracking, and we don't want that. There are certain drugs which, if your mother took when she was pregnant, it exposes you to breast cancer. There is a particular drug which was very common between 1940 and 1971. It is a drug that was used to help eliminate miscarriages, and the name of this drug is diethyl stilbestrol, and it's a drug which everywhere you will see it is just written DES. And it's just a long name, so that it's a short form of the drug so that everyone can remember. And mothers who took this drug in order to avoid miscarriage ended up having these children who were more likely to have breast cancer. Some other things which you want to really take into consideration is family history. If you have a parent, so a parent who can be a mom or a dad with breast cancer, because yes, men do have breast cancers too. If you have a parent, you have a mother, you have a sister, you have a child who has breast cancer, you are at a higher risk of having breast cancer. Additionally, there are certain genetic mutations. I'm sure most of us have heard of BRCA1 gene and BRCA2 gene. These are mutations which, when people have these mutations, they are more likely to have breast cancer or even ovarian cancer. So if anyone in your family has the BRCA gene, you as a family, you probably need to seek genetic counseling if you have that possibility. And because the probability of having breast cancer if you have the BRCA1 is very high, and so you want to try to do something about it to mitigate your chances of having breast cancer. Okay. Then one of the most important things, let me just call the last thing out, is the duration of your menstrual period. So if you have menstrual period before the age of like 12, 13, they say if you have it around the age of 12, you are more likely to have breast cancer than someone who has the beginning of menstrual period later on in life. And in the same token, if you have menopause after the age of 55, it reduces your risk of breast cancer. Before the age of 55, you are very much exposed to having breast cancer. And again, if you have your first pregnancy after the age of 30 years, you are very more likely to have breast cancer than as compared to someone who maybe had their first pregnancy in their early 20s. And this is just because of the fact that there are certain hormones which come with the menstrual period. There are actually hormones which happen to peak during the age where you have your menstrual period. And the hormone which is called estrogen is one of the hormones that it puts you at a high risk of having breast cancer. So women who've never had term pregnancies, or women who've never had children, or women who have children but do not breastfeed, just put themselves at a higher risk of breast cancer. In other words, if you have children, breastfeed them. Not breastfeeding your children is not modern, as a lot of people say now. So again, by so doing, you will reduce your risk of breast cancer.
Wow. Before I go to my question, Bill Foster is asking you a question to Dr. Does a nodule in the breast indicates the cancer falsely? Bill, I don't know.
So
Bill, do you understand it, doctor?
Yes, I think I know where he's coming from. It's like any nodule in the brain in the breast. Does that mean that it's breast cancer? I think. Yeah. Am I right, Bill?
Yeah. Bill, is she right? Just answer along those lines, then, though.
Yes. So again, one of the things which why we emphasize about lumps in your breast is because, yes, most of them are not breast cancer. But if they happen to be breast cancer, it is dangerous. So once you have a lump in your breast, it doesn't necessarily mean that you have breast cancer. And I can just take that a little bit further. So one of the things which is very, very important for every single woman is to know their breast. You have to know your breast. And if you start realizing that there is anything looking abnormal in your breast, you should be concerned about. If you're someone who maybe has something which feels like a lump, maybe I'll call it in parentheses lump, and it comes during your menstrual period or just a week before your menstrual period, and then it disappears and it comes back and forth, that is most likely not breast cancer. And some other things which can cause lumps in your breast will be something like having a cyst. There are cysts. Cyst is just like a nodule, but in the middle of it, you do have fluid. And so that is not, it's usually not breast cancer. And so you can have other things which are not breast cancer, but once you have a lump, it's very, very important for you to have yourself checked.
So let's go back to dense breast, doctor. How do I know if I have dense breast?
Okay, so the way you know that you have a dense breast is by mammogram. And I will just take this opportunity to talk a little bit about a mammogram. What is mammogram? A mammogram is just an X-ray of your breast, and it's taken in a particular way to be able to see all the areas of your breast. If any of you has ever had a mammogram, you realize that they take it from every single angle to make sure that they take a picture of all the breast tissues. Mm-hmm. So can you just show that black and white picture we had before again? So once the two pictures you see there are pictures of breast mammogram. And when you take a mammogram, the area which is fatty area is usually in black, as you can see in the first breast, that you can see the fatty area. But now the area in white is usually the area which has the lobules and the fibrous tissues. Ooh. That happens to be the same way cancer will appear on a mammogram. Okay, so once you have a mammogram, it shows you that, okay, that white area is the area with the lobules and is the area with the fibrous tissues. But now, if you have cancer, if you have calcifications in your breast, they do appear white too. So you're unable to distinguish between them. So if someone has a dense breast, they take your picture, it's looking very white. Mm-hmm. A lot of the times, the physicians they have to ask a few more questions. And if they don't ask questions, if they send you a picture and say, well, they send you a mammogram result stating that you had dense breasts, you should ask questions. The things you want to ask at that point are, what are my risks of having breast cancer? If you have higher risk of having breast cancer, they have to do further imaging. And the reason they're doing further imaging is to be able to identify any cancer that might be little, which is still very small, which is still asymptomatic at that point. So if you have cancer that is small and is hidden in there, you have only a mammogram, they can tell you that is fine. There's nothing wrong with you. It is okay. And that is also one of the reasons why they say women who have dense breasts should have a mammogram more frequently. If you look at, again, we will go over the guidelines as to who gets a mammogram and when.
Yeah, exactly. I can't wake up and say, let me just go and do a mammogram.
Yes, and no, that is not the case. You do have, again, if you have dense breasts, they'll tell you do a mammogram maybe every year. Because why? They want to make sure that nothing is hidden in that dense breast that they are not seeing. And again, if not, once you have a mammogram and you have a high risk of breast cancer, they will go ahead and do other forms of imaging like an MRI of your breast to make sure that there's really nothing hidden in there.
So for you, Elmina, did you have dense breasts?
Yes.
Oh.
Yeah. Okay. But I didn't know before.
Yeah.
I didn't know, because I've only done mammogram 4 times, but that was when they found the breast cancer. But I was supposed to do it earlier during the year, but they turned me down and they said, oh, you're not 40 yet, so it's not going to show.
Okay, because in the UK you have to be 40 to be referred to do mammograms.
Yes.
So once they found out, Elmina, walk me through when you went to after they did what was the thing they did when you were lying down? You said
they did ultrasound.
Ultrasound.
Yes.
So from the ultrasound to diagnosis of cancer, walk us through that process.
Pardon? Sorry, say that again.
So walk us through from when you did the ultrasound and they said to you that, oh, okay, we may need to do a mammogram and all of those steps. How was it for you? And I really want to see emotionally. I want us to tell us emotionally how that journey was for you.
I think I knew already it was gonna be breast cancer, so I was okay with it.
Why did you know that?
It's me. I'm that lucky. So I'm sorry, but yeah, because the way you can tell from, because when I told that doctor that I had to have this lump out, and she said no. When she walked into the room, I saw her face and I saw she'd been crying. So I told her, it's okay, don't worry about it. I've been here before.
Right.
And so I told family members already. We were prepared for. We're hoping for a better case, but prepared for the worst. Yes. So on the day that we had to go and take get the results, because we're already preparing for the worst, I had to ask Michael, my husband, to, stay at work, because I know we're gonna be needing time off. Later on, because it's gonna be loads of hospital appointments, and I had to have a friend accompany me. Yeni, she came with me. And I don't know what I would have done without her, because when she said, whatever the case is, we're gonna walk out there like Tupac. After Tupac won his case, we're gonna strut our stuff out there. Yeah, like that. Yeah. So and we sat down, and the doctor came in, the oncologist came in, and the nurses came in, and they started talking. And they said cancer. So as soon as I heard it's breast cancer, I burst out really loud and started crying. And he paused for a bit and, to make sure I'm okay. Then he carried on talking. Then he said, oh, we're going to do reconstruction. I'm like, oh, hold on. You mean I'm going to have, he says, yes. I said, are you sure I'm going to? Yes, I'm so okay then. That's fine then. I think I can manage with this. At least there's light at the end of the tunnel.
I like that. I like that you grabbed onto the positive and you held on to it. So yes. I mean, I hope that that speaks to somebody who is going through this or who is awaiting a diagnosis, that, you know, that positive attitude goes a long way. I'm sure Doctor agree with me. But just before I bring, Henrietta is asking you, what symptoms were you experiencing, Elmina?
I would say just a sweaty armpit. I used to sweat a lot, and I didn't know that it was a symptom. So I did change a lot, but I did ask the oncologist. I said, "Is it because of the sweatiness? That's a sign of breast cancer?" He said, "It's not written down anywhere, but loads of women have experienced the sweaty armpit. I don't sweat anymore.
Okay.
After the lump is out, I don't sweat anymore." So,
doctor, so what are some of the symptoms in addition to the sweating thing? What does medicine say about the sweating?
So again, most people who have breast cancer do not even have symptoms, especially at the beginning. Most of them don't have symptoms at the beginning. When symptoms usually show up most of the times when it is in an advanced stage. But of note is the fact that one of the most important and significant symptoms we see is getting a lump in your breast. If you touch your breast and you feel a lump in your breast, that should alarm you. You should seek medical attention. Again, I cannot overemphasize the fact that every woman should know every angle of their breast. You should feel your breast, and if anything feels like it's abnormal, then you should at that point seek medical attention. The other thing that should be concerning, if you notice any swelling of any part of your breast, you notice any redness in your breast, you notice any change in the skin of your breast, you should seek medical attention. Don't take it for granted. If you realize that you have having dimpling of the skin of your breast, and the skin of your breast is beginning to look like the skin of an orange. They call it pot orange, and you see that in books. If you start realizing that you're having that type of skin, you need to seek medical attention. Don't wait and say, okay, this is just something that will go away. Seek medical attention. If it's nothing, then it's better. If you realize that you're having retraction of your nipple, and if that is continuous, you keep on having retraction in your nipples and it stays like that, you should seek medical attention. Another thing, which if it's also looking at your nipple, if you realize it's becoming red or it is having flaky skin, and that is not how it was, don't just say, oh well, if you have anything there that you don't know what it is, you have to seek medical attention. If you are having any discharge from your breast when you're not breastfeeding, if you have blood coming out of your breast, you have milk coming out of your breast when you're not breastfeeding, you're not supposed to be breastfeeding, then that is a call for concern. So those are some of the symptoms that you will notice with breast cancer. And again, these symptoms do also come with pain. They're painful, and if you realize that there's just a big change in the size and shape of your breast, especially when it's just one-sided, again, you should be concerned about that. Seek medical attention. If it's nothing, it's nothing. But if it's something, it can enable that thing to be cut early on enough, which gives you better chance of cure.
So this is dimpling?
Yes, that is dimpling of the breast skin. See this something looking like what you have right now, then you should seek medical attention. Don't ignore it. It may not even be hurting. If it is hurt, it could be hurting, but it may not hurt at all. And so, but if you see it, it's not a nothing. It is something you have to get yourself checked out.
Wow, something so simple.
Yes.
There is a question that he asked. Dr. Pa asked this question. Can a woman with complete hysterectomy stand a risk of having cervical cancer?
So we're skipping to cervical cancer. Well, again, if you have complete hysterectomy, it means you still have the cervix. You can still have cervical cancer insofar as you still have part of your cervix in there. And when they do hysterectomy, they don't take out the cervix, they take out the womb. So, yes.
Okay, and then there's other questions. Sorry, let me. Oh, that's okay. So, somebody was asking, do you say benign or malign? When you said the lumps were benign, somebody asked, is it benign or malign?
Oh, okay. So it could be both. So benign just means it's not cancer, right? Malignant or malign just means it is cancerous. And you have a lot of lumps in your breast which are benign, which means they are not cancer. It could be something like a cyst. At times, people even have scar tissue in their breast, and it feels like it's a lump, but then it's nothing. You could have those. But then, that one time when it is a node, which is actually the nodule or the lump is cancer, you want to make sure that it is caught. And so that's why we say don't just assume that it is benign, or don't just assume that it is not cancer. You want to make sure that it is not cancer.
Okay. So for you, Elmina, thank you, Doc. Thank you for that. Other people are saying that this is very informative, super informative. I'm getting that a lot in the comments. Elmina, so this is you, and I really want to see your journey, because I really want that. And I do know that quite a few people are watching tonight who are undergoing radiotherapy. I know that a few people are still going through therapy. Some chemo, some radiotherapy, some have just done the surgery. So I think we're using it tonight as a beacon of hope, but at understanding that you went through the same probably fears and scares that they are going through at this time. So you have, I think, complete the journey to diagnosis. So from the doctor telling you it is cancer, then what? And like, what were you feeling, and what do you wish that your loved ones around you, how do you wish that they could communicate this thing, communicate with you? Does that make sense? Yeah. So how do you wish that they could communicate with you at that time? Because sometimes we can be very insensitive and wanting to say the wrong thing but end up saying the wrong thing. Like, no worry, God will figure you to it, if he handle. Or don't worry, the Lord is your strength. You're wishing somebody well, but some of those things can be very annoying. So please tell us.
I think I'm very fortunate that my family and friends were very supportive, but I had to make sure that I reassure them that I am okay. The treatment is going to be really bad.
Yeah.
And I am going to be okay, because with the diagnosis, they said it's curable.
Okay.
So that was something to hold on to. So I remember telling my husband that it's going to be very hard for him looking at me. Even though I would look tired and worried, I'm not. And family members as well. Everybody was worried. At times, it's not good to show the patient how worried you are, because all I needed was positivity. No matter what, it had to be positive. No matter what, no matter how bad the situation was. That's something that I've learned through the years, that no matter what my condition is, I had to be positive. Because once you stop being positive, that's when you start being sick. I've always said my body is sick, not my mind. And the only thing I have control over, it's my mind.
Your mind.
And once you let go of that, the treatment takes everything from you.
So Brigitte is asking, what stage was your cancer?
Oh, mine was grade 3, so it wasn't at the stage yet. So it was caught very early.
Okay, so doctor, what does that mean medically, grade 3, and what are the different stages?
So again, I think the most important thing for people to know is that once breast cancer is diagnosed, there are a few things which have to be taken into consideration to decide, one, how it's going to be treated, two, how severe the cancer is. So the first thing is, if lymph nodes have been involved, if you do have involvement of lymph nodes, then that kind of like means that it's a more severe cancer. So if you have lymph node positive cancer, that is one of the things that gets taken into consideration. The second thing is the size of the cancer. If you have cancer that is greater than 0.5 centimeters or 5 millimeters, then it's different. And again, a lot of the cutoff is around 15, and the bigger it is, the worse it is. It is my understanding that Elmina started with about 20 centimeters, 20 millimeters, or 2 centimeters, which is considered a large cancer.
Mm-hmm.
The other thing which gets taken into consideration is the presence of receptors.
Wait, hold on, Doc. So Elmina had a large cancer.
Yes.
Okay.
She had 2 centimeters,
yeah.
And once it starts getting above 1.5 centimeters, the therapy starts changing at that point.
Yeah.
Okay.
Mm-hmm.
And then another thing is the receptors. The cancers do have 3 types of receptors, and I mean, I know for us we use those terms really easily. We're like, what are receptors? So consider receptors like every cell does have what we call receptors on them, or in other words, these are just like not a key, the locks to a door, right? Some of the cells do not have these locks, some of them do. So you can see here there are 3 different locks right there, even though they look all pink, even though they're all pink, but there are different types of receptors. In people who have breast cancers, you can have estrogen receptors, they call them ER receptors. You have progesterone receptors, and you have they call the Herceptin receptors, which are written HER2. So you will see they will report, they will say ER, PR, or they say ER, PR positive, or ER positive, PR negative, or HER2 positive, HER2 negative. And you can see that was also reported in Mina's results. And so that just means that you do have those locks which can be opened. We have medications which are considered like keys. Consider these medications to be keys to be able to open those locks. And then once they open those locks, you can put in whatever needs to be put in order to kill those cells, right? Mm-hmm. If you do have receptors, what happens? It means there are certain medications that could be used to treat that type of cancer. Mm-hmm. If you do not have receptors, then you're probably going to be treated only with chemotherapy, and then radiation therapy, and then surgical therapies. But if you have receptors, then they are treated differently. So, for example, if someone have the estrogen receptors, the ER positive cancers, they can be treated with tamoxifen. And tamoxifen not only treats that cancer, but then it prevents you from having breast cancer in the future. So you treat with tamoxifen for a long period of time. Usually it's 10 years. And again, the same thing happens if you have, or you can be treated with.
Almina has, yeah.
You can see it says for 10 years.
There you go. Yes, you're treated with that for actually 10 years.
Yeah.
Right. And if you do not have that, you have another type of receptors, which is the HER2 receptors, or the Herceptin 2 receptors. They just write HER. In some countries they put the R twice. In some countries they just put HER2 positive. If you have that, then they can treat you with certain medications, which they call, one of them is called like adalimumab, and not everyone can get those treatments. So they look at those receptors, they look at all the other things we talked about, and then the grade of the cancer. The grade of the cancer just tells you how, if it's a more aggressive form of cancer or a less aggressive form of cancer. And so if you remember when we looked at the image of the cancer, you have like the lobular areas, you have the ducts, and so cancer can come up from, there you go. So cancer can come from any of those areas. It can come from the lobules, it can come from the ducts, it can be localized in those areas, it could be extended to those areas, it could be, they call it in situ, which means it's only in that little side, which means if you take it off, you've taken it off, right? So it depends on how aggressive the cancer is, and they give different grades to the cancers. Mm-hmm. And so, again, you look at lymph node involvement, the size of the cancer, receptors, and the grades of the cancer. These are the things that determine how the cancer is going to be managed, how it's going to be treated. Mm-hmm.
So if I hear that stage 4 cancer, am I saying, oh, there's no hope?
So stages is different from grades.
Okay.
Yes. So for stages, they use all of these things we talked about to be able to determine the stage, especially how spread the cancer is, how far it's gone, mm-hmm. and And again, the size of the cancer, right from there. If it is a small cancer that is localized only in that area, it doesn't have any metastasis there. The way they usually call it, they start giving names like M1, N1, M for metastasis, and N for node involvement. And so how distant it has spread, and that is where we get the stages. If you have any cancer that has already touched the lungs, it's already spread at a long distance, then you start thinking of, oh, this is maybe you're getting to stage 3 and stage 4 cancers. But it's cancer which is still localized only in that area and maybe touching just about a lymph node or so, then you're still in the early stages that you can get radical surgical intervention to take out all the areas which are involved. And the stages is still a relatively early stage. So the grade is different from the stage. Some cancers are more aggressive than others, and that's what we talk about the grades.
So Clementine was saying here about yellowy or bloody discharges. So is that from the breast? You can have bloody discharges and yellow discharge from the breast.
That is correct. And just as we talked about earlier, that, you know, some of the symptoms of breast cancer, when you have symptoms, could be discharges from your breast. Anytime anything is coming from your breast, if you're not supposed to be breastfeeding, if you did not just have a child, you have to be concerned about. That could be blood, it could be any form of discharge, it could be just clear liquid coming out of your breast, it could actually be milk coming out of your breast. And if you have those situations, you need to seek medical attention. You're not supposed to be having stuff coming out of your breast anytime. It doesn't just make that decision.
Does that apply to men as well?
Yes. Men can also have breast cancer. And yes, if men have lumps in their breast and they're having discharges from their breast, they should seek medical attention.
Thank you very much for that. Elmina, so I'm going back to you. When I look at this picture, this is you in the hospital, still so positive, still so radiant. I mean, that's you in the hospital, and you know exactly what you're going through, and everyone around you is concerned. I'm sure your husband and your family were besides themselves. For you personally, what messages were you telling yourself when you were lying on that sick bed? What were you telling yourself to stay so positive? And were you ever scared? And when you were scared, what did you think? Did you ever think, oops, or like?
No, I was never scared. I was grateful that they found it early and it's curable. I was never scared, never worried. I was in a lot of pain, but I knew I was going to make it because I know that's the only way to be. Because the first one was in 2002. So I know how to be, to stay well, because my body is not well, but my mind is the only thing that I have to keep that in check. So I did cry a lot, but it wasn't for fear. It was aches and pain, side effects, because I used to do chemo on Monday, and by Wednesday I was back at the A&E for aches and pain. So I had then do loads of tests to find out if there's anything wrong, because with the chemo comes loads of side effects and loads of aches and pains. I had it to go back ready by the door, so that once I start feeling the aches and pains, it might be 2 o'clock in the morning or in the afternoon.
So is there no like medication you can take, like I don't know, something really for the pain?
There are loads and loads of medications. They don't always work. When it's painful, nothing they give you works. So they'll give me like morphine. It's gonna work for maybe half an hour, and it's gonna maybe relaxes me a little bit, then I'll sleep. Then when I wake up, it starts again.
Right.
Yeah.
So the pain is severe.
Yeah. Oh God, the pain is severe. It's severe, but you can't let that take away from you, because you're fighting for your life. You can't, if you're in a fight, you try your best to win.
Yeah, true.
Yeah.
So there's some questions, and by the way, Elmina, so many people are saying they love your courage. Continue to stay positive. Henrietta asked, Doc, are there any preventative measures to reduce the risk of developing any form of cancer? Oh, sorry, Doc. Sorry. Yeah.
Okay. Oh yes, there are preventative methods. So, and I'll tell you this: one of the things which, as you can see, are the risk for breast cancer. For example, there are different types of risk, and it could depend on some of the risks are modifiable risk, and some of them are non-modifiable risk. Right. So if you have things like your age, you cannot change, your race, you cannot change it, breast density, you can't, drugs, which maybe your mother took, there's nothing else you can do. If your family members have breast cancer, there's nothing you can do about that. You already have that, even though nowadays there's something you can do about that. And we will talk about that particularly. And if you've had cancer in the past, you cannot change that past. But there are certain things you can do. If you have obesity, is one of the things that causes that puts you at a high risk of having breast cancer, and there are other cancers which are also associated with obesity. And so, and not only obesity, but also having a sedentary lifestyle, which means an inactive lifestyle. So it's encouraged that you do physical exercise, you maintain healthy weight. Even if you have a healthy weight, you still exercise. Exercise by itself brings a lot of advantages also, and reduce your risk of breast cancer. If you have a family history for certain cancers, or for certain genes like the BRCA genes, which we talked about, you can seek counseling. And there are nowadays, I mean, all of us know someone like Angelina Jolie's battle with the mother had BRCA, she had BRCA genes, and she did bilateral mastectomies. And there are even some medications which doctors can administer to block your estrogen. You remember we talked about your prolonged menstrual period, and estrogens being something that can put you at more risk. There are medications that can be given to block those. But all of this, the medications, the genetic counseling, you have to have those risk factors in order for them to be able to do anything with regards to that. And again, just taking good care of yourself, eating right, making sure you eat more plant-based foods than animal-based foods. I'm not advocating for people to be vegetarians, but I'm just saying make sure you kind of like balance things up. And by so doing, you can reduce your risk. I mean, you can't imagine how important it is to get your weight in to a reasonable weight, to something that works for you.
I don't know, doctor, if an ultrasound says it is fibroadenoma, must it be removed? Suppose a fibroadenoma lump is removed, can it reoccur? And if it does, is a second surgery needed?
Okay, so that is a multiple part question, right? So fibroadenomas, usually once they have them, they monitor them. They're kind of like precancerous stages. So once you see that and they have
what's fibroadenoma?
So a fibroadenoma is like kind of a precancerous state. And so once you have it, some may elect to remove it, and some
may like fibroids.
It's a little bit like fibroids, but just a little bit more advanced than that.
Okay.
So they may remove it. You have to talk with your doctor at that particular point, and you make decisions together and decide if you want to remove it or not. And if it comes again, it's something which has to be discussed with a medical professional, because they have to take other things into consideration. Again, just like the risk factors. What risk factors do you have? How old are you? And if you have any family history, if you already have dense breast, so they have to take those things into consideration.
So when they tell us all the time about breast cancer screening, what are they talking about?
So breast cancer screening just simply means it's a method. They're trying to find any form of breast cancer before it becomes symptomatic. Right? And again, there are different screening methods, but again, the most common and the most acceptable worldwide is the mammogram. So if you really want to do screening, what are the things you want to start with? Let's start with the basis. The mammogram, which is the x-ray of your breast. And the medical bodies, the medical associations have not been able to agree on what the best should be. But I want to use what we call the USPSTF guidelines. This is a United States Preventive Services Task Force, which actually look at all the studies that have been done on breast cancers and so make a determination on to what is going to be the best thing for them to do or the best thing that needs to be done for you. So, and what are their recommendations? They recommend that between the age of 40 and 49, it is your decision if you want to have screening of breast cancer. You talk with your doctor. If you have high risk factors, then your doctor can be like, yes, let's do screening. And at that point, it is done every 2 years. Some bodies do say that if you have a relative who's had breast cancer, you should start 10 years before the age the relative was when they had breast cancer. So if you had a relative who had breast cancer at 40 years old and you are 30, that is when you should really start having those discussions with your doctor to determine if you should start screening. Based on the USPSTF guidelines, they do say that you start that screening at 40. If you discuss with your doctors and you agree, you do it every 2 years. Now, they say if you get to the age of 50, between the age of 50 and 70, you should have the screening every 2 years. So it's not, that is a recommendation at that point. It's no longer something which is like where you weigh your risk, you weigh your benefits, and you decide if you want to do it or not. The American College of Physicians actually endorses the USPSTF guidelines. Now you have the American Cancer Society, which has guidelines which are a little bit more aggressive. They do state that between the age of 40 and 44, you should talk with your physician and they weigh your risk factors to see whether you should start screening. If you start screening, it should be annually, so every single year. Between the age of 45 and 55, they do recommend that you have screening every single year. And at the age of 55, from the age of 55 to an undetermined age, which I will explain what undetermined means in the situation, you can choose to have it every year or every 2 years. And then when do you stop having screening? They say if based on your other comorbidities, which means based on your health situation, your general health situation, if they anticipate that you still have more than 10 years of life, then you should continue getting the screening. Okay. If the anticipation is that you're not going to live up to 10 years, then there is no point in screening.
So basically, screening is just so that if you have it, they can catch it early.
Yes, if you have it, they can catch it early and they can be able to start treating.
Start treating it.
Yes. And again, screening is very good for early discovery of the cancer. Screening does not come without its own effects. It causes, at times you can see something which looks like cancer and which is not really cancer, or some non-aggressive form of cancer, something benign, and they start chasing it. It is, once that is the case, it is time-consuming, it is expensive, it is nerve-wracking, and at times it could be invasive. If you're doing a biopsy for something which was just found like that, and it ends up not even being cancer, it's an invasive procedure that could have been avoided. And again, with the screening, something like a mammogram has a lot of false positives, which means something looking like cancer, but it's not really cancer. A mammogram is not ideal. It may miss some cancers also. You have to have that in mind. And that goes to the point that you have to, as a woman, you have to know your breast. I cannot say this enough. Once you see something that is not right, it is not right.
Women, know your breast. Women, know your breast. It is yours.
Exactly.
Rosemary is asking, do those medications that girls bought at the roadside in Cameroon called e-tablet used after unprotected sex be putting them at risk for breast or cervical cancer?
Wait, what type of medications? What is it?
To prevent pregnancies, called e-tablet, she said. Well,
for the sake, I will not take any medication by the roadside in Cameroon. There's no way you'll make me do that. If you see me taking that, you know that it's someone else who just fakes to be me. It cannot be me. But that said, most of those medications do contain hormones. Some of them contain like estrogens. Some of them are actually just starch or placebo, but some of them contain estrogens, which again expose you at a greater risk of breast cancer. You know, it's the same discussion we're having that women who do not have children have a greater exposure to some of these hormones. Postmenopausal women who are taking hormones for more than 5 years period expose themselves to breast cancers. They have a higher risk of having breast cancers. So again, hormones are things which, if you don't need them, you shouldn't go for them. If you need them, it's different.
Thank you very much for that. I hope that. I mean, it's cancer, isn't it? There's just nothing apart from Elmina, who is giving me so much hope. Honestly, Elmina, listening to you and talking to you, it is giving me a lot of hope that cancer, because a lot of times when we hear cancer, we think, hey, now all this person.
Death sentence.
It is just that a death sentence, but I'm so happy. I'm so happy when I look at you, and I hope that other people are looking at you from the same light that I do. But Elmina, looking back on your journey with cancer, looking back on your journey from 2002 till now, is there anything that you wish you had known before, that you know now, or is there anything that, I don't know, is there any message in that for you?
Yeah, psychological help. Psychological help does a lot, because like I said before, your body is sick and there's nothing you can do about that, because your chemo kills all your good and bad cells. There's nothing you can do about that. So the only thing you have going for you is your mind. Yeah. And once you if you have the right support around you, that goes a long way. And don't turn down help, or don't be afraid to ask for help, and take this psychological help that the hospital is offering, because here in England everything is free. And I remember the first time when I was first diagnosed, and they asked me if I needed to talk to someone. I'm like, oh no, it's okay, I'm fine. I don't really need help. But after a while, after it sunk in that, oh yeah, you're sick, I said, yes, please, I need help. I need somebody to talk to. Because I think then I didn't know how to ask for help, even though everybody was offering. And people say, oh, do you need me to do this? I'll be like, oh no, it's okay, I don't need it. Even though I needed it, I didn't know how to say, yes, please, could you help me? But having this appointment with the psychologist, they said you have to be able to ask. Once you start asking, you start getting. And once you have the right support and everything that you need, you'll be better off.
So ask for help. Don't be afraid to ask for help.
Don't be afraid to ask for help. The hospital appoints a nurse for you, so you can call them day or night. The hospital has different numbers. As soon as you call and say, I'm a cancer patient, they attend to you straight away. Yeah.
What do you? How is in your case your husband? How was it for him? Do you have any idea? I don't know if he wants to speak for himself, but how was it for him? I think emotionally, I want to know, dealing with you, watching somebody you love so much. What effect do you think it had on him emotionally, psychologically, and all of that?
It was very hard for him. I could see it was very, very hard for him. And because he knows I'm very strong, he tried to be strong as well for me. And we were very fortunate that we had lots and lots of love and support. His mom was here. My cousins came around. My sister. It's very, very hard to watch someone in pain, and there's nothing you can do.
Yeah, can imagine.
And it's very hard, because even my son, he could tell at times from the look on my face that something is wrong. So he does what daddy does. He comes and he'll give me a kiss, and he called you like everything will be okay. But I think it's for me, I was okay, but I could see that it's really
he's helpless.
Yeah, he needed help. He needed family around, somebody for him to talk to. And you know, men, they can't ask for help. They don't know how to ask for help. Yeah.
Sorry, you're making me want to.
I'm sorry.
It's okay. It's okay.
He did a very good job because he did everything that needed to be done. He did everything for me and for Morgan. And I don't know what I would have done without him.
Take your time. Take your time, Elmina.
I think the only reason why I'm this positive is because he's there 100%. His mom, his sisters, my sister, my sisters, my brothers, my cousin, even the school that Morgan goes to. They were all behind me, and some of them mom friends.
Oh gosh, Elmina, it's okay. Just take your time.
It's good to have support. I'm so grateful. That's the reason why I am the way I am. That's the reason why I'm positive, because there was a lot of help. I didn't have to cook. I had family friends near me who cook, and she lives an hour away. She would drive all the way just to make sure that I have something to eat. My sister would do the same. My cousin, my Morgan's friends in school, their moms used to help us, come and take Morgan from home and take him to school, so that Micah didn't have to take a lot of time off work.
Yeah.
And so that Micah's mom didn't do a lot of back and forth, because she lives in Wales. So yeah, I'm very grateful. I had a lot of love, and I'm grateful. I think that's why I'm the way I am, because my sister, my brothers, my cousins, everybody
around you.
Yeah. Sorry.
No, it's okay. I think, Doctor, and while I give Amina time to get herself back together, what in your experience, Doctor, is the benefit? If somebody doesn't, if there's somebody going through this now who doesn't have that kind of support system that Elmina has been blessed to have, what kind of advice would you have for that person?
It's very important. You may not have support from family. It's important that you have, if you have a church, you have a community. One of the things which is very common in our African communities is that people have things like cancer and they do not talk about it at all. And that is a big problem. There is no reason to have a stigma when you have cancer. You do have to talk about it with people. It's not anything that you brought upon yourself. It's not anything that you did. And so we have to learn to talk to people. We have to learn to ask. There are people, a lot of, you can't even imagine how many nice people are in this world, which if you just open up to them, they will be able to help you. And so just as much as you can, just open up yourself, let people know what you're going through, and people will be more understanding. If they don't have your paradigm, they will not treat you with that paradigm. So it's very important that they know what you're going through, and in that way, people are kinder than it looks. People are much more kind than you can imagine. So if you're going through that, you don't have family, or you don't have, you'll be surprised what strangers can do. So just keep an open mind, stay as positive as you can, get yourself into some form of community, be it your church, be it your neighborhood, be it wherever you are. Get into that type of relationship. That is very important.
Yeah. And I think there is a stigma in our community, honestly, that about cancers. When people have cancers, people don't talk about it. People don't talk about it. And I hope that Elmina and Doctor have both encouraged you to see the benefit in talking about it because when people know what you're going through, like you said, Doc, people can be more understanding of exactly what it is and how they can help you if they can in any way, and just being there for you. Doctor, on that note, we will move on to prostate cancer because my father died of prostate cancer, but he was much older. He was in his 70s. You know? What is prostate cancer, first of all?
So, I mean, for you to understand what prostate cancer is, prostate cancer, again, is an abnormal and unregulated growth of cells from the prostate gland. I know you do have a picture of the prostate gland. Can you please put that picture up so I can kind of like show what the prostate is, where the prostate is, and we can be able to go from there?
So I have it. I'm just trying to bring it.
Okay.
Because I'm going to pull it up.
Yes, so the prostate gland is a gland that is found, let me call it a gland or an organ that is found between the bladder and the penis, and is found in front of the rectum. So this is a gland the purpose of this gland is to produce seminal fluid, and seminal fluid nourishes sperm and it helps with transportation of sperms. So this is a gland which can develop into cancer like most other things, and it's very frequent. And again, you do have specific risk factors for this gland to turn into cancer, but then once it usually occurs in men who are older. And if you look at the lifespan of a black man, 1 in 4 black men end up developing prostate cancer.
Yep, 1 in 4. 1 in 4.
1 in 4 black men.
Black men, yeah, will develop that. It is quite high and quite scary to me. So.
Yes. So up to 1 in 4 men will develop the prostate cancer within their lifetime, and there are specific symptoms. So if you look at that image, if you see where the bladder is, and it is labeled, and since I don't have a pointer, I can just going to go with the label. If you look at it, you have the bladder, which is right up there, and just below the bladder you see the prostate gland. And that is where that gland is. And then, as you can see, the gland it's in front of your rectum. Your rectum is, if you look to the right side of the image, you will see the labeling of the rectum. And so it's right in front of there. And I'll let you know why I keep insisting on the fact that it's right in front of the rectum. And so there are specific risk factors for prostate cancer. You have age. Again, once men start getting above a certain age, they are more likely to have prostate cancer, and most of the times it is 55 years of age. And race, again, it still goes back to the same thing. Men who are black men are at a higher risk of developing prostate cancer. And then family history. If you have, family, let's say, a father who's already had prostate cancer, again, the sons are more likely to have prostate cancer as compared to someone who doesn't have a family history of prostate cancer. Additionally, the BRCA gene mutation, which we talked about earlier, if that runs in your family, it does expose you, gives a higher risk of having prostate cancer also. So BRCA, yes, that BRCA gene.
That gene is also a cause of cancer in women.
Yes, it's a cause of breast cancer, it's a cause of ovarian cancer, and it's a cause of prostate cancer.
Wow.
Yes. Last but not the least is obesity. So men who are obese have a higher risk of having prostate cancer, not breast cancer. Okay, so there are certain things also. When people have prostate cancer, what happens? They have the symptoms are like difficulties urinating. So they do have like a very weak stream, urinary stream. It's very weak, or they just have even really just problems urinating. Another thing that happens.
When you say, what do you mean? Like what? Like the pee? When you say a weak stream, what does that look like?
So imagine you open a tap, right? You can have the tap which is just running very weak and very slowly, or you can have a tap that is comes out really strong with a strong stream, right? So people who have prostate cancer would easily have a very weaker stream of urination as compared to someone who doesn't have anything blocking that area, right? And if you could see, the prostate gland actually goes around the urethra. The urethra is the path where urine flows.
Yeah.
Yes, so if you look at it, it's right there. The urethra, you can see it is leveled right down there, but then it goes right up to where urine flows, right up to the bladder, and it passes inside the prostate gland, as you can see. So yes, you have a problem with the urine flow, and the force of your urine is really weak. You can have pelvic discomfort. You have discomfort around your pelvic area, and for people who have prostate cancer. Another thing is prostate cancer easily spreads to the bone, and so they have bone pain. You can have pain around your rib, you have pain around the back, you have pain around the hips due to prostate cancer, and you can have erectile dysfunction in people who have prostate cancer.
Brigitte is asking, is it true that too much meat can cause prostate cancer?
So it's a tricky question. Again, meat by itself is not known to cause prostate cancer. But again, unhealthy diet, which is kind of like very much animal-based, it puts you at a higher risk of obesity, and so at a higher risk of prostate cancer. Yeah.
You know, I'm sitting here. My husband, a few months ago, went on a mixed diet.
Yeah, you hear all the keto diet and all of that, but you know,
that now has me concerned because he ate quite a lot of meat during that time. So you're giving us the symptoms. So what does a screening for prostate cancer look like?
So prostate cancer screening is, again, one of the controversial things which is out there. The medical bodies can barely agree on what they want to do with regards to prostate cancer screening. But again, one of the things that the United States Preventive Service Task Force, USPSTF, does recommend is that when men are between the ages of 55 and 69, they should they should talk with their physicians, talk with their doctors if they need screening or they do not need screening. And so again, the way the doctor will kind of like tell you if you need screening or not will depend on your risk factors, and the risk factors which we just talked about earlier. You know, your age, your obesity, family history, having certain genetic mutations. So if you are at a higher risk of it, then they'll tell you to do screening. Some other organizations don't actually advocate for a prostate cancer screening using PSA. PSA, which is a specific antigen that goes up for people who have prostate cancer, but it also goes up when you have prostatitis or an inflammation of the prostate, or it also goes up when you have BPH, which is just a growth of that prostate gland. So it goes up in a few things, not just cancer, even though in most cases it goes up the most in people who have prostate cancer. So it's just very important that you start the screening. You start talking with your doctor as soon as, especially if you're a Black man, because that by itself is a risk. You start talking to your doctor if you should do prostate. If they need to check your PSA.
And for us, because our show is majority of our audience of the TWE tribe is women. I think if you have brothers, sisters, brothers, husbands, loved ones who are both 40 and are Black men, you should really start urging them and encouraging them to go do a screening for the PSA, especially with the statistics that 1 in 4 Black men will have prostate cancer. That is quite high. So, Job, how is can you hear me? I don't know if you're frozen.
It's breaking a little bit, but I can hear you. It's breaking.
So how is the prostate cancer diagnosed?
So there's something they call the digital rectal examination. That is usually one of the first things that is done. Most of the time, the digital rectal examination will realize that your prostate is larger. The digital rectal examination usually it's even more helpful when you have just hypertrophy of the prostate. But the main way they do it is by transrectal ultrasound. So you do a transrectal ultrasound and you realize that something is not right, and then you can do a transrectal biopsy, and then to get tissue from it. Once you get tissue, then it will definitively tell you this is cancer or this is not cancer.
So what's something trophy you mentioned, and what does a transrectal biopsy look?
So a transrectal biopsy is you go through the rectum. It actually through the anal area. You go through the anus to the rectum, and then you can go through the rectum and get a sample of the prostate. Okay. Once you get that sample of the prostate, then you can be able to do any testing you need with that. It will tell you if it is cancer or not, and it gives you something they call the Gleason score. The Gleason score just tells you if this is cancer that will spread easily or it will not spread easily. If this is something where you have to be aggressive with the treatment, or you can watch and wait.
Okay. Well, thank you. Thank you very much for that information. I'm going to go now to Elmin. Are you okay?
Yes.
Okay. I'm going to go now to some of the questions, because there have been quite a few questions. I obviously can't promise to see everyone's questions, so please everything. I'm going to really try and read them.
Okay.
So, Anyan asked again, is someone with fibroadenoma undergo pain, right pain, and does someone feel pain when it is cancer?
So, let me get the question. Say, why do they have pain?
Yeah.
Okay, so again, if you have fibroadenoma, you can have pain because it is pressure in that area, right? It's going to be a little bit, it's something which is not supposed to be there. And so just causing compression in the area by itself can cause pain, right? Again, people who have breast cancer can have pain. And a lot of the times you can end up, you have pain if you have breast cancer. But again, what was the second part of the question?
Why do they have the pain? And once you feel pain, if you have fibroadenoma and you feel pain, does that mean it's cancer?
No. If you have you can have pain from fibroadenoma. So pain is not a specific sign for cancer now.
Okay. And then he goes on to ask, or it is said the breast has to be sucked to reduce the possibility of cancer. Can a breast pump be used to replace that sucking in case there is no to suck?
Wait, so I think I understand what she's trying to ask. That if it means, in other words, if you breastfeed, right, it reduces your risk of cancer. Can you use a breast pump to do that? The answer is no. And because breastfeeding is not just the physical sucking that makes you breastfeed, it's all the changes that go on with pregnancy, post-pregnancy hormones that cause you to produce the milk, which can then be sucked with the breast pump. If you, whatever way it is that you get the breast out, the milk out that has been produced, is good enough. So, but if you do not have, let's say you don't have children, using a breast pump is not going to reduce your risk of breast cancer. If you have children, either the children sucking the breast by themselves or you using a breast pump to get the breast milk out is the same thing. It doesn't matter how it comes out. But again, if you don't have milk in there, or you don't have, you didn't have a child, you didn't undergo pregnancy to have all the changes that cause you to produce milk, using a pump on your breast makes no difference.
And then this person asks, sorry, Nicola Elminati, why does cancer of the breast and cervix spread more after the patient has undergone their first surgery?
Wait, what is the question?
Why does breast cancer and cervical cancer spread more after surgery? Is there truth to that?
No, that is not correct. That's not correct information. It shouldn't spread after surgery. The purpose of the surgery is to remove the cancer, right? So it shouldn't spread after surgery. But what happens is a lot of the times, some of the times when the cancer is being removed, maybe part of it stays, it's not completely removed, and that still continues spread. It spreads, or the cancer already spread and they did not remove everything, and so it just seems like it spread after the surgery, but that is not really what happens. And there is something we call seeding, but it's not common, where during removal of cancer, you can kind of like, the cancer cells can drop in another area and then grow into cancer cells. But it's not common, it's very theoretical, it's not anything that should raise concerns. So surgery does not, it reduces your chances of having metastasis, it does not increase it.
Thank you. Elmina, do you have any question for Doc?
No.
Listening to all of this, I mean, what's going through your mind? Like all of this.
I think it's making me value life more, because with all the information that doc is giving, some of them I didn't get from my doctors. Maybe that's because most of the times once they said cancer, I didn't hear anything else. Michael had to do all the listening. He had to do all the listening. Yeah. And you just have to I'm just counting myself lucky.
Yeah.
Because of all the information I'm getting now, and my doctors and nurse, my cancer nurse, she is really good.
Okay, that's good.
Yeah.
That's good. So I mean, I've learned a lot. I feel like my head is full of information right now. But I'm so glad. I'm so glad that we're able to we're able to have this show. And I really thank you, and Doc. I thank you, Mina, for sharing your story. After the show, you will go back to the comments, and everybody's saying the same thing. I mean, your positivity is infectious, and just you being courageous enough to be this vulnerable with us. You know our community now. You know, nobody wants the world to know that they have cancer. I don't know for whatever reason, but I hope that, you know, watching you has inspired or encouraged those who are currently suffering with or living with cancer to be more open to speak up.
Yeah. Because I think I did a lot of this, you know. I'm proud to show that I have it, because I can beat it. Because once you're hiding, you're not only suffering inside, it's like you're not accepting the treatment, you're not accepting help.
Yeah.
Positive vibes help. I remember when I started losing my hair, I'm like, oh good, I need to shave it off. And I shaved everything off. I used the cream so that it was proper bald. And some people didn't know I had cancer because I looked good. Because my eyelashes didn't fall off in time. So eyelashes and eyebrows, they didn't fall off. So when it started falling, I was like, yeah, at least now they're gonna know. Yeah, like that. Yeah. So because even sometimes when I went to the A&E with doctors that haven't met me before, and they said, oh, why are you here? And I'm like, it's like, I said, my hair, can't you tell? I'm Kim. It's like, oh no, I thought it was just a trend.
That was the right attitude.
Yeah.
I think that positive spirit is what I would take from this, honestly. Just, you know, stay positive and have hope. There's a question for you, Doc. Auntie Lisa is asking, does the length of breastfeeding matter?
The length, I don't know what she means by length, but I'm going to try to.
How long you breastfeed, does it matter?
So again, I'm looking at how long in terms of like, I got it. Yes, it matters, because as long as you're still breastfeeding your child, even if the child is 3 months and another child is 9 months, as long as you're breastfeeding them during that particular time, you're reducing the exposure time to the estrogens. Does that make sense? Yeah. So the more you breastfeed, and be it in intervals, maybe you're having 3, 4, 5 children, the lesser your risk is, you know. And that's why we encourage women to breastfeed, because you don't want to just be like, okay, I'm not breastfeeding, 1 month, I'm done, and all of that. You're reducing the advantages you have of breastfeeding as compared to someone who breastfeeds a little bit longer.
Wow. No, knowledge is wealth. I wish I knew that. I would have breastfed like 2 years. Honestly, information. Wow. Is there any traditional cure for cancer? I saw that question. I think my mother asked that.
So, you know, there are certain things, I don't know how they call them in Cameroon. There's something they call black cohosh, which people can use for menopause instead of using the hormone replacement therapy. You know, they say if you do use the studies have shown that if you use hormone replacement therapy for more than 5 years, you greatly increase your risk of having breast cancer. But if you use cohosh is something which has been studied and has actually been approved to use in menopause in place of hormone replacement therapy. So it's a plant. I'm not exactly sure what it is specifically, but I know that it's a plant that you can use. And here you have them being sold in medicine, in herbal medications store areas, and you can.
Again, Hawash?
Black cohosh.
Black cohosh.
Black cohosh, yes. Yeah, and you can get that. So in other words, if you have any chances of reducing your hormones, using hormones, and you have alternatives that can cause you to not have to not use the hormones after menopause, those can reduce your chance of breast cancer.
So it's possible then that there are some traditional medicines that could help.
That is correct. It is very possible.
Okay. Clementine is saying that people are saying men should have sex 21. Is that 21 times a month to prevent prostate cancer?
Well,
is there any truth to that? 21 times a month?
No, there is no. Let me put it. No scientific evidence of that I'm aware of, or that is published in the most renowned medical literature. No.
So, Clementine, in other words, that's bad. That's nimbo talk. And it comes to, what about the regular intake of soya products?
I mean, soya products are very healthy products. Soya bean is one of the very high protein containing plants. And so, yes, it is something where you can take it in place of maybe using the processed meat we already have here a lot in our Western world. It's something good it's something good to take. Yeah.
So because I read somewhere that too much soya can cause, I read that we shouldn't drink too much soy milk because it can cause cancer, and I stopped giving my children soy milk.
I'm not aware of that literature.
Okay. It's one of the many things we read on the internet then. So Leonette is asking, do implants put you at risk of any cancer?
Breast implants? Definitely yes.
Okay.
Yeah. There are implant-induced breast cancers and very well known in literature, and they're just specific cancers that come only because of breast implants.
Elmina, please, you shouldn't do it.
Oh no, that's why they're giving me they're taking fat from my stomach and my thighs to do the reconstruction. Not
that is
implant. Yeah.
Yeah, exactly.
But even with the double mastectomy and the tamoxifen, I'm still at risk of still getting it. So just have to stay positive.
It reduces your risk greatly. It does reduce the risk greatly, but that risk is always still there. You know, they say that every single woman is at average risk of cancer. They don't say it's at no risk, you know. So, yes.
Yeah, so it says the statistics say 20 in 100,000 women will have breast cancer.
That is correct. About that number in 100,000 women. But prostate cancer, as you know, is worse than that. It's 40. It's it's actually 40 in 100,000 women will have breast cancer.
Okay.
For men, it's 1 in 4.
Oh wow!
1 in 4 black men.
Yes.
And those numbers are just to black people. I'm not talking of the general population.
Wow. Wow. So Maslow is saying that bitter leaf juice is also very, very good for cancer. I think that's what you mean.
Okay. I can't confirm or deny that. I don't know.
And then last couple of questions before we go. Dr. Anyan is saying, Doctor, you talk of hormone receptors. Can hormones be used as preventive measures for breast cancer, or is hormonal imbalance some of the cause of breast cancer?
Okay, that is a very good question. So again, not necessarily hormonal imbalance. There are different types of hormones that the body produces, that the female body produces during specific times of the month, right? During your menstrual period, certain hormones are higher than others, and during after menstrual period, certain hormones are higher than others. So estrogen particularly is known to cause breast cancer. And this at least takes me to a specific topic which we did not talk about, that you have treatment for breast cancer such as tamoxifen. Tamoxifen has both anti-estrogenic and estrogen effects. So it has both of those effects. Now, because of its anti-estrogen effects, that is why it can be used to treat breast cancer. But it does induce menopause, early menopause. People who use estrogens tend to have menopause at a younger age. Now, the estrogen effects of breast cancer is that they increase your risk of medication, of the estrogen effects of tamoxifen. So extra estrogens will put you at a higher risk of endometrial cancer. It increases bone density. It puts you at a higher risk of having blood clots.
Oh yeah.
Yeah.
They didn't tell me that. They didn't tell me that.
They didn't tell you that.
I'm also looking to change the tamoxifen because of the, menopause and weight gain. Even though, like right now, I've lost my appetite. I'm not eating a lot. I'm not eating a lot, but I'm still putting on weight. So
yeah, tamoxifen can do that. But the thing with tamoxifen is that we really don't have, right now, we don't have alternatives. They have raloxifene. You have other classes of that same medication. But most of them do have similar side effects. One of the things which with tamoxifen you have to watch for is PE, blood clots to your lungs, or blood clot to your legs. It increases that risk. And women who are already in menopause, they don't take tamoxifen, they give them something else, which is called aromatase inhibitors. Yes, and an example is a medication called anastrozole, but we're not going there. So if you're on tamoxifen, let's say you're on tamoxifen for 5 years and then you go into menopause, the question we usually would ask you, what do you do at that point? Do you change it to anastrozole, to an aromatase inhibitor, or you're going to leave continue with tamoxifen? The answer is you have to continue with tamoxifen and give the full 10 years of the tamoxifen.
Thank you, because last week I emailed my doctor asking to see if there's something else other than tamoxifen, but thank you.
What did you say?
No, I emailed my GP and he just called me today to say I have to talk to the breast care team to see if they can change it, if they have any other options.
Right.
Yeah, because I don't know a lot about tamoxifen. I only know the side effects. Like I'm here right now with a fan because I'm having hot flashes.
Oh dear.
Right. And I'm putting on weight and I can't finish a full piece of toast. It has to be like at least half. But I'm still putting on weight.
Okay.
Yeah.
Yeah. So unfortunately, we don't have a lot of options right now. There are other medications which are very close to it. They can give medications to help with menopause. They have some group of, it's antidepressants, but they're also used for menopause to help with some of the symptoms.
I was just gonna say on a good note, with the tamoxifen gaining weight, it means I can have bigger, so I can have bigger boobs. The more weight I put, the bigger they can do.
Now you can keep the size of your boobs, right?
She always finds the silver lining. I love that about you, Elmina.
That's good.
Rosemary is asking, what about birth control pills and risk of cervical cancer? Because I know that my doctor told me that I shouldn't, we have the after morning pills, right? And the doctor told me we shouldn't take, I shouldn't take that, many of that, because that increases my risk of cancer.
Right. So the birth control pills, some of them are actually hormone pills, so it's more like you're just taking the hormones. And so, yes, they do put you at a higher risk of the breast cancer and of cervical cancer.
And then a last question, I think she's repeating this. Doctor, can you talk about genetic testing?
So when we talk of genetic counseling, it's indirectly saying that you go to the genetic, because it's more like, I cannot tell you this is what you should take, but yes, genetic testing is very important. If you do have risk factors, which include like the BRCA gene in your family, or any other genetic mutation that you're concerned about, you go for genetic testing, and then most of the times they'll counsel you, talk to you about it, and then they do genetic testing on you also to make sure that you do not have it. Maybe something which just runs in the family, but you didn't have it or you had it. Because if you don't have it, then yes, your family could have it, but if you don't have it, it reduces your risk much more. The risk is much more lower.
Although I would say for that, if you are like Elmina, you can win the lottery in the sense that nobody has in your family and you started with it. Like in Elmina's case with anyone.
Right. And you know, hardly will you be tested if there are no risk factors. So if you've never had anyone with your family who's had breast cancer, and you go there and you say, oh, I want to be tested for BRCA gene, I doubt if they're going to test you, except you're just going to pay whatever to get tested. That's different. But the medical counseling will not be, well, guess what? If you want to be tested, get tested. That will, your insurance is probably not going to pay for it.
Okay. And there's a question. How about pregnancy prevention implants?
So some of those implants are embedded with hormones, but not all of them. So you have to be very informed of what that implant is made up of. You know, some of them, if they are the ones which are fully embedded in hormones, then it's something you need to avoid. If you're really concerned about cervical or breast cancer. But there are lots of them which are not, which don't have all those hormonal effects. There are different pregnancy prevention methods which do not have hormones.
Honestly, doctor, you're really thorough. And Rosemary, for real, says, kudos to you and all our doctors out there. We have many natural plant seeds that God has given us to cure a lot of diseases. But times many don't want to mix their treatment. But honestly, doc, this has been really informative. My gosh, the depth of it to which you've gone, to explain all of this to you. I can't thank you enough. I think I'm speaking for us all when I say thank you, thank you, thank you, thank you, thank you, thank you, thank you so much for the time. I know how busy you are, so I appreciate it so much. Because to get you, I really know how busy you are. So for you to block these 2 hours for us, honestly, I will say God bless you. Thank you. This has been really good.
Thank you for inviting us, and thanks very much to Ermina. I think your courage speaks a lot, and I'm very grateful you were willing to open up like this, and I think you shed a lot of light to what is going on in our communities.
Yeah, and somebody is asking, can I have the name of that plant again, please?
Caroline. It's black cohosh. So it's black like the color black, and it's COHOSH.
Okay, black cohosh. I think I'll write it in the comments for everyone. Black.
Yeah.
And also, I can send it to you by,
please, and then I will put it on the resources page.
Right, I'll do that. I'll send it to you.
Thank you, Doc. I will. Elmina, any final words to Doc, to your audience, and to anybody who is going through what you've been through, and to any of us who would go this a multi-layered process, and to any of us who will go through this in the future? Any final words?
Yeah. Don't be afraid. It's like you can't go into a fight that you want to win and you're scared.
Yeah.
You go in like that, because that's how I did it. And make sure you have the right support. Don't be afraid to ask for help. Don't be afraid to cry. Don't be afraid to be weak, because you have to be all those things for people to give you help. Because I think I needed those things. I made everyone aware that I needed help. That's why I am the way I am. That's why I'm positive. My support and love was very, very strong. That's why I'm walking now like this.
Like Tupac.
I've done the hair, change my dressing, and I walk with so much pride. I do a lot more now. I've got so much energy. I don't know where it's coming from, but I am thankful that I had cancer because it's made me better. It's made me stronger. Yeah.
Yeah, and I'm thankful for your support system, because that's truly what they were. They were the wind beneath your your what?
Wings.
The wind beneath your wings, and so now you can soar as high as you want to. So I'm really thankful for your support system, and for anybody who's got a loved one that's going through this. Let's take a leaf from Elmina's book, and just be there in the best way that you can be there. And if you're going through this, let us know the things that we are saying that we shouldn't say. Yeah. If you don't want to hear us say something, then please just tell me that irritates me, and then so we know not to put you in that state. And you, Doc, you've been brilliant. So any last words to the community, number one, on cancer, and to anybody that's going through this, and in your experience, as a physician in that field, any words of, I don't know, wisdom, prevention, anything you have to? Over to you.
The only thing I'll really tell people is that, again, if you're going through any medical issue, including cancer, ask questions, understand what you're going through, so that you can also be able to fight it. Be courageous. I can never really say I fully understand, because I've never gone through that. But be courageous, be strong. I can't even begin to wrap my brain around it, and I can't really, I see Elmina. I think she embodies what courage is, and you be courageous. Make sure you get all the help you can get. There is nothing like keep your pride on one side and get help, and that makes a big, big difference. And again, I will still repeat it to women: know your breasts. And if anything doesn't look right, it is not right. Seek medical attention. Advocate for yourself. Don't hide things. If you have cancer, talk to people. You will be surprised what people can do for you. So that is all I'll put out there for now.
Thank you guys so much. And on that note, I'll keep you backstage, but please don't leave while I say goodbye to our guests of tonight. So thank you so much, Elmina and Bob. Are you saying bye?
Bye-bye.
Oh, thank you guys so much for staying till the end. A lot of us have stayed, and I just really want to thank you. Thank you for it's October. Throughout October is Breast Cancer Awareness Month, and if you think that this episode that you've watched is beneficial to anybody, please share this video. We need to. Awareness is key. Awareness truly is key. I've learned a lot of things, especially about breastfeeding, that I didn't even know the benefits. The benefits, some of the other benefits, especially in relation to cancer. I wish if most of us women, if we had known that, we would have breastfed for like 3 years, wouldn't we have? Anyway, so thank you. As Clementine is saying that, let your husband feel your boobs. They will always know when there's a change. You see, so on that note, make sure husband, knows that those boobs as well as you do. Why am I blushing? But it's true, she's so right. But on that note, thank you. And if you're new here and you haven't already, please don't be a stranger. Like her page so that you stay abreast of our shows. For now, we are doing every Friday, and please, I have received all of your messages. Those who say Friday is difficult for them, they prefer Wednesday. We're going to test it. So bear with me. We're going to do it next Friday again. And if I still get the same comments that people prefer Wednesday, because I've got quite a few people saying, why didn't you stick to Wednesday? Wednesday is easier for me because Fridays I'm so busy. So if our shows have been Wednesdays and Fridays, but now we're going weekly, from the 50th show, which is our 50th show today. So from next week, we'll do Friday. But if I still get a lot more of the response of people suggesting, so let me know what you think, please. Do you want it Wednesdays? Are Wednesdays more convenient, or Fridays? And we'll go with the majority. I'm flexible for now. Okay, but thank you so much. Please like our page on Facebook, The Gorete Experience, same name on YouTube, The Gorete Experience. So please subscribe and let's grow this community. We're on episode 50. Go and spend a couple of hours and watch the rest of the episodes. Like I said, we've gone through the gamut of topics, so there is something there for you. So please make sure, and thank you, Doc. Thank you so much, Elmina. I really can't appreciate you guys enough. And I'll see you guys next week, Friday. So from me and our main guest, bye-bye.